night and welcome back to our talk show on With KTV, Women in the Know. We are your hosts, myself, Nicole Cassidy Elcock, and my co-host,
Kashana Mihis Ali.
and joining us this evening are a group of wonderful, highly esteemed women. They are here this afternoon to share some wonderful information with you, our audience. And at this time, we would allow them to introduce themselves to us. And ladies, please tell us a bit about your background, starting with Dr. Biki Manmohan.
Good evening, everyone. Thank you for having me here in the show this afternoon. I am Dr. Savita Biki Manmohan. I am a school educational psychologist. My job is to administer psychological and educational assessments, behavior management, counseling, and consultations.
Thank you.
Good evening, everyone. I am Dr. Kimberly Redman. I am a medical psychiatrist. My job description requires me to care for patients who has mental disorders. I assess both physical aspects and mental aspects of psychological problems, and I treat both adults and children.
Thank you,
Thank
Dr.
you.
Redman.
Good evening, everyone. My name is Hema Sukram. I am a social medical worker. I assist individuals, couples, and families with psychosocial, economical, cultural, and medical issues and illnesses. We can be found at hospitals, clinics, health centers, and workplaces. Thank you.
Thank you,
Thank
Ms.
you.
Sukram.
Good evening, everyone. Thank you so much for including the society in this groundbreaking discussion this evening on With K.
Oh, yes.
I am Jenelle Bruno Hamilton, the founder and president of the Attention Deficit Hyperactivity Disorder Society of Trinidad and Tobago. It is quite a mouthful, so let's use the acronym going forward.
Sure.
You know, the ADHD Society of Trinidad and Tobago, it was established in 2012, and it was really born out of denial, acceptance through research, wanting to do better for my daughter who has been diagnosed with ADHD and for others in society. So thank you so much for having us.
Thank you.
Thank you, ladies, for being here. So today we are going to be examining the 2007 award-winning film Juno, written by Diablo Cody and directed by Jason Reitman. This film depicts a 16-year-old girl who decides it is time for her to experience sex and enlists her best friend Paulie in an experiment he's not too eager to join. However, our expert panel will touch on the underlying issues that invoked the teenager's behavioral patterns and choices. That is attention deficit hyperactivity disorder, also known as ADHD. Dr. Vicky Manmohan.
Attention deficit hyperactive disorder, known as ADHD, is the most common neurodevelopmental disorders of childhood. ADHD is a common condition that is caused by differences in the brain. People with ADHD have trouble with focus, some are hyperactive and impulsive. While nearly every one of us exhibit these characteristics, as we can all relate to being inattentive, hyper, or impulsive at times. So the question is, do we all suffer from ADHD?
Good question.
Good question.
An individual is suffering with ADHD if these behaviors are present to a marked degree that it interferes with daily routines and creates many challenges in areas of life. Dr. Redman will continue.
Thank you. Agreed. In addition to what Dr. Biki Manmohan just said, ADHD can be likened to listening to our favorite show with noise disrupting the signal. All the while, loud children, are screaming around you in the background and throwing things.
Okay, thank you for sharing that, Dr. Redman and Dr. Biki Manmohan. Now that we understand what ADHD is, let's visit the trailer of Juno.
prognosis, fertile myrtle. Minus or plus?
There it is. That little pink plus sign is so unholy.
That ain't no Etch-a-Sketch. This is one doodle that can't be undid, Holmes Gillett.
Just tell him. I'm pregnant.
Who was the father?
It's Polly Bleecker.
Polly Bleecker? I didn't think he had it in him.
I know, right?
Did you see that coming?
Yeah, but I was hoping she was expelled or into hard drugs.
Or a DWI? Anything but this.
I could, like, have this baby and give it to someone that, like, totally needs it.
You should look in the Penny Saver.
They have ads for parents.
Yeah, desperately seeking spawn. Hi, I'm Vanessa.
Hi, I'm the husband.
This, of course, is Juno.
Like the city in Alaska.
No.
You're a part-time lover and a full-time friend.
When this is all over, we can always get back together.
Were we together?
Yeah, we were once, you know. At time.
You think you're really gonna do this then? If I could just have the thing and give it to you now, I totally would, but I'm guessing it looks probably like a sea monkey right now. We should let it get a little cuter, right?
Great.
Keep it in the oven.
Fox Searchlight Pictures presents a comedy about life.
Well, I thought you were the kind of girl who knew when to say when.
I don't really know what kind of girl I am.
And the bumps along the way.
Your little girlfriend gave me the stink eye in our class yesterday.
Katrina's not my girlfriend, all right? And I doubt that she gave you the stink eye. That's just the way her face looks, you know? That's just her face.
I don't know if I'm even ready to be a father.
Yeah, big puffy version of Junebug. Where you been?
Just out dealing with things way beyond my maturity level. I need to know that it's possible that two people can stay happy together forever.
The best thing you can do is find a person who loves you for exactly what you are.
Juno.
Your parents are probably wondering where you are.
Nah. I mean, I'm already pregnant, so what other kind of shenanigans can I get into?
So, Dr. Redman, from the onset, Juno seems to be a typical teenager who clearly likes to dress extremely casual. And although it may seem shallow to narrow in on her appearance, is there a connection between her appearance to ADHD?
Not necessarily connected, but ADHD can affect one's choice in dressing and grooming and other daily tasks that persons without ADHD take for granted. When you are living with ADHD, it is easy to focus on the logistical details such as arriving on time, trying to remember all the important items.
Right.
It can be easy to think, no one will be looking at me, and grab the nearest shirt from the pile of clothes by your bed.
Wow.
Thank you. So, from the standpoint of someone living with ADHD, as we trail along the critique of this movie, Juno, please briefly tell us what are the main characteristics associated with ADHD?
These main characteristics of ADHD are hyperactivity.
No thanks. I'm off pills. It's a wise choice, because I knew this girl, she had this, like, crazy freak out because she took too many behavioral meds at once, and she just, like, ripped off her clothes and dove into the fountain at Ridgedale Mall and was like, I am a kraken from the sea.
Impulsivity, extreme inattentiveness, and executive dysfunctions.
Very interesting, Mrs. Sukram. As we continue, let's look at something from the movie. Would you say the portrayal of the character and the ADHD exceptionality was consistent with your research, Mrs. Bruno Hamilton?
Yes, indeed, because the movie Juno is as real as it gets to someone depicting someone with ADHD on a movie. This is outside of Finding Dory and Finding Nemo. You know the character Dory? Our children may have introduced us to that. ADHD is not always that cannot sit person that's always fidgety, you know, and that's one of the difficulties in detecting ADHD in someone who is not that hyperactive. This is one of the reasons for the establishment of the ADHD Society of Trinidad and Tobago. It's really to bring awareness, to provide support, and, you know, access to resources that is needed for persons living with ADHD.
Thank you.
Now, this is an open question. I know Mrs. Bruno Hamilton mentioned that it was indeed one of the best portrayals of ADHD, but not the main concept of the movie itself. Tell me, can you share ways in which the portrayal of the character and the ADHD exceptionality showed inconsistencies with research?
I agree, Juno was one of the best portrayals of ADHD. As for inconsistencies, ADHD is one of the most common disorders of childhood, and yet the diagnosis is controversial. There are no specific cognitive, neurological markers or medical tests for ADHD. Many link this disorder to hyperactive, mischievous young boys who get in trouble in school all the time because they can't sit still. While some persons with ADHD appear this way, it shows up in a variety of ways in different people. Girls and women are underdiagnosed because of these reinforced stereotypes. Many adults with ADHD continue to suffer without help, believing that the disorder affects only boys.
Yes, it was a realistic portrayal. It is important to note that ADHD cannot be cured. But if you follow a treatment plan, it is feasible to manage your ADHD and live a fulfilling life. An ADHD treatment plan may include either medication or behavior therapy, or a combination of both. Behavior therapy is conducted by a trained professional to help people with ADHD manage their behavior so that they can function better in their environment. It is helpful also to join a support group such as the ADHD Society of Trinidad and Tobago as part of our management plan.
Thank you, Dr. Redman. Now let us dwell into some real-life experiences in the mind of someone with ADHD. So, Mrs. Sukram, what real-time experiences have you had that may have helped you understand Juno and ADHD?
Okay, so yes, I did an interview with Ms. Shanaz Ghani, a 37-year-old mother of 3. She was diagnosed with ADHD at the age of 10, also as well as a son. Ms. Ghani struggled straight through primary school and was discriminated against by her teachers. She showed all the signs. She could not focus, concentrate. She had difficulties sitting. She was not the hyperactive type that causes distraction. Ms. Ghani resits the SEA exam and for the second time, and her teacher realized that something was wrong with Ms. Ghani and advised her parents that they need to take her to get a diagnosis and treatment, which they did, and she successfully set the SEA exam. Ms. Ghani entered Form 1, and everything started to click at that time. She got straight grade 1s, straight to Form 1 to Form 5. She also did A-levels and her master's. Ms. Ghani today is a primary school teacher, a private primary school teacher, and a part-time lecturer at the University of Trinidad of the West Indies. Also, Ms. Ghani have a 9-year-old son who was also diagnosed with ADHD and is taking treatment and a medication called Consider. It have him calm and focus. Sometimes he has his ups and downs, but he is doing fine. A message she left for parents today is that get your child tested, have them get the treatment, understand your child, have patience, get yourself, and never give up. Thank you.
Good. Beautiful.
That is indeed very inspirational. Thank you, Mrs. Sukram, for sharing that. So, follow-up question. So, how does the ADHD Foundation for Trinidad and Tobago bring awareness for persons like Juno, Mashana's, her son, and others as it pertains to sensitization and discrimination they may face in diverse settings?
That's a really good question. Thank you for that. And Ms. Sukram mentioned something to never give up, and that's what the society does. We never give up. The three words, it's one word repeated 3 times for emphasis. Education, education, education. We have to educate our society. And just as when you look at Juno, you saw a teenager protesting anti-abortion with a placard, the society uses that form of medium as well. But we also print flyers, brochures, and so forth. The society also brings awareness in the form of sensitization sessions. We conduct it. I mean, you call us wherever you are in Trinidad and Tobago, and we'll make ourselves available because we really want to bring that awareness across Trinidad and Tobago. The society also provides a support group for persons with ADHD exceptionalities, but not just them. We have to tackle the employers and other stakeholders, persons who they are associated with, so that we can get that awareness across TNT.
Thank you. Thank you for sharing, Mrs. Bruno Hamilton. So, co-hosts, as we near conclude this movie critique, we'd like our panelists to answer a few questions for us. For this final question, tell us, everyone, how has the movie Juno impacted you? And we will start with Dr. Biki Manmohan.
Juno has really brought about an awareness for me about the abnormalities that can indicate a potential medical condition called ADHD. Additionally, the challenges people face living with ADHD, for example, the struggles to get organized and manage their emotions. This movie has impacted me to give support to persons living with ADHD, as I have learned from Juno that ADHD is a biological condition, and most times these patients, they act on impulse and can't help themselves to stay focused. I realized from the movie that ADHD is a condition that doesn't go away. But with the right treatments and support, people with ADHD can strive and make moral, life-changing decisions.
Thank you.
The movie has helped with the structuring of my thinking towards exceptionalities. It has brought to my attention how much I did not know, and it raised the question in my mind, how many more persons do not know the difficulties persons living with neurodevelopmental disorders undergo on a day-to-day basis, as Dr. Manmohan mentioned. And the movie highlighted the persons with ADHD can have learning disabilities, impulsive behavior, they can be insensitive to others' emotions, and they battle with their own emotional experiences. Juno enhanced my curiosity and attentiveness with regard to behavioral issues. The behaviors demonstrated in the movie, as well as additional research, serves me as a guide to identify persons with differences. As a prospective educationalist, I desire an appropriate knowledge to be part of a support system for such individuals.
Thank you.
Well, I frequently hear teachers express dissatisfaction with children who are highly active, out of the seats and conversing with classmates, when the teacher wants them to sit and do their work. Juno the film helped me understand ADHD in a variety of ways. As a preschool teacher in a classroom, this film and other research made me well informed about attention deficit hyperactivity disorder. I am now able to recognize children who are struggling with ADHD, but I am also aware that the symptoms and behaviors associated with ADHD may also have other possible explanations. Thank you.
Thank you, Mrs. Sukram.
Yes, thank you.
I am so appreciative of all that heartfelt comments from my fellow panelists. You know, Juno really reminded me that we are all human beings with some sort of imperfection. You know, it's categorized for technical and scientific reasons, but we all deserve kindness, dignity, and respect. My personal view, though, of ADHD exceptionality is that it is just a cognitive difference. Why? Because with early detection, support, and treatment, persons go on to achieve all that they endeavor to achieve. As a society, we will continue to normalize treatment. You know, just as how when you have a physical ailment, you'll go to the doctor, I think for mental illness, that's what we should do as well. It should not be taboo and secretive. And we will continue to change the narrative of ADHD exceptionalities to one that is positive.
Thank you, Mrs. Hamilton. You know, one of the main things that captured my attention in this movie was the fact that Juno was a teenager struggling with ADHD.
Yes.
I believe we often forget that ADHD goes on to adolescence and adulthood. This is not just something that children struggle with. I was able to see the struggles and symptoms of a teenager with ADHD, and it goes beyond being hyper, misbehaving, and struggling in school. And especially in adulthood, these symptoms tend to differ.
Yes, yes.
Thank you so much for your responses, ladies. The movie Juno provided an insight to the challenges persons with ADHD may experience daily. However, the research that I've done in conjunction with the invaluable information that was shared today on this forum has been an eye-opener. You know, it's comforting to know that persons who are struggling with their symptoms of ADHD can readily have access to this wealth of information.
Yes.
Additionally, they can consult with extraordinary persons like you all that are here with us today who dedicate your time, your research, and your efforts towards diagnosing, counseling, providing treatment for, and bringing a general awareness to the attention deficit hyperactive disorder. For those in our audience who are persons with ADHD, or persons that are yet to discover your diagnosis, also teachers, prospective teachers, parents, you are not alone. I do hope you've enjoyed this experience with us today.
In a world
where you can be anything,
just be kind
to everyone, including
persons with ADHD.
See you next time. Good night and goodbye.
Goodbye.
Goodbye.